Should you get a deviated septum surgery if you are having trouble with your breathing? So in this video, we're going to cover what this surgery is. We're going to cover the recovery time, what happens really in the surgery, what the aftercare is, and especially things that I wish that I would have known before I got involved with this surgery. So first of all, this isn't my normal content. I normally make business and HR content, but my name is Matt if you're new to my page, and I'm going to tell you why I had to have this surgery in the first place. So first of all, what is this surgery? Septoplasty surgery, or deviated septum surgery, is a surgery on the inside of your nose. In your nasal canals that allow you to have clear breathing, that surgery to fix that and unblock it, basically drilling a new hole back there so you can have a right nasal passage, is called a deviated septum or septoplasty surgery. A rhinoplasty surgery is, or a nose job as people know it as, is on the outside of the nose. Now, sometimes when people have a rhinoplasty, they also have a septoplasty to fix their breathing inside. So many doctors that are doing a nose job will also fix a deviated septum. So a deviated septum can happen for a number of different reasons. First of all, it can be if you ever get hit in the nose, like if you're a football, a hockey player, anything like that, that type of hit can basically bend your nasal passages in a way that has to be fixed with a surgery. The second way is you can have a really bad sickness, like a respiratory type of a sickness, and that respiratory sickness can deviate your septum, literally, and make it permanently hard to breathe. Now, this happened to me in 2020 when the pandemic happened. If you remember that the first variant that happened with COVID was in about November, December. I got it in December and I was horribly sick with a respiratory sickness for about 3 weeks. Now, before that, I never had any problems breathing. So if you have sleep apnea where you have to sleep with a breathing machine, that can be very hard on your heart because you keep waking up and that puts a strain on your heart. And that strain is really bad for you. It can cause heart attacks and everything else later. So this surgery can really be life-saving for people that have trouble breathing, but you have to go through the route with doctors. And I know I'm going to get this question, so let me cover it up front. This surgery is covered by insurance if you get the doctor to say that you need it. So for me, I got this really terrible nasal blockage. And after about these 3 weeks, my COVID went away, my mucus, and sorry to be gross, everything else that comes with being really sick went away. However, I still couldn't breathe properly through my right nostril. I had maybe 5 to 10% breathing through this nostril, and I couldn't get any air through there, and it caused a lot of problems. I was mouth breathing, which is also really bad for you, for years. So fast forward about 2 years later, I knew this was a problem. I'm kind of a stubborn guy, and I never really went and got it taken care of. Like a lot of other guys, they just don't get things taken care of unless it's like a catastrophic level. I should have done it right away, but I didn't know. I kept thinking it was going to get better, but it just never did, and I wasn't paying attention to it. And then I had a really weird series of events happen. And the series of events were, I got COVID again in 2022, but it was much the tamer variant that only was like a cold for a week. So I got this about halfway through 2022. Then I was okay for about 2 weeks. That sickness only lasted about a week. Then I was okay for 2 weeks. Then I got a terrible cold that lasted like 2 weeks. And then after 2 more weeks after that, I was kind of okay. Then I got strep throat. So I was like, okay, something is really wrong. Like my immune system is really down. Something's really wrong with my breathing. This is all like not okay. To get sick 3 times in a month and a half and basically be sick for 6 weeks with 2 weeks in between each, I was like, something is wrong. So I went to the doctor, and the doctor referred me to an ear, nose, and throat specialist. So I went, and he looked in there, and he had me open my mouth, and he went in the back, and he goes, I bet you feel terrible, don't you? And I go, why do you say that? He goes, not only is your septum completely deviated, he's like, I can't even get back to see in there properly. He said, you also have extremely inflamed tonsils. And I said, well, what do you mean? And he said, well, this keep getting sick pattern that you're on is going to continue to happen in the future. So what happened with me was, he said that when you have a deviated septum, this is kind of another gross thing, but all throughout the day, fluid from your nose just goes down the back of your throat. It's unconscious. You don't even know what happens. But if you have a deviated septum and a blockage in there, if air can't get through and fluids don't move normally, that can end up dripping on your tonsils. Now, your tonsils are a thing that holds inflammation, it holds bacteria, all of that kind of stuff. And your tonsils holding all that bacteria was causing me to get sick over and over. So he said, not only do you need to have a deviated septum surgery, you also need to take your tonsils out. So I was like, okay, wow, this is going to be a big deal. But I didn't understand how big a deal it was. I didn't understand that this was major surgery. Now, what I mean by that is to have your tonsils out when they do it to little kids, usually in a couple days, the kids are running around and they're fine. It's a harder recovery for adults. So he's talking about 2 surgeries at once. And so I went home and talked to my family. I was thinking about it. And my girlfriend said, Matt, you can't breathe at night. It's really bad. And I said, what do you mean? And she goes, next time you fall asleep before me, I'm going to record it so you can hear how you sound. So it was only a couple nights later. I was asleep, fell asleep watching TV, and she recorded my sound. I sounded like a grizzly bear that was nuzzled up in its den for the winter. And she said, you're tossing and turning. She said, I can tell you can't breathe. It was really loud and really bad. And I was like, man, I sound horrible. So I decided to do it. I decided to schedule the surgery. I went in, and at first I had scheduled to take a week off of work. Let me tell you, that was not long enough, especially if you're going to have both surgeries, guys. So even just for a nose job or a septoplasty, usually you want to take at least all week off for adult, but that plus the tonsils, I ended up being off work for about 3 weeks. So now you don't have to have them both done at the same time, but if you're having a problem with your tonsils and your adenoids, which are the other things in the back of your throat there, just have them taken out, because then you won't have any more disease held back there. You don't need them once you're adults. And if you just get it taken out, then that's all it is. So I got a rickety old car. I gotta push up on the roof on sometimes. So the surgery overall, what they basically have to do is they have to kind of drill another hole straight back in there so that you can breathe. And that happened, and then they took out my tonsils and my adenoids, and then I had a complication with my surgery. And the complication was that when they go back to take out your tonsils, they're actually using like a hot soldering tool. And when that happened, the doctor actually burned the left side of my tongue, and I had about 1.5 inch burn on the left side of my tongue. So not only to have a fresh hole drilled in here and have my tonsils and adenoids taken out, but I also had a burn on my tongue. So I went home, and I will tell you guys honestly that I was completely unprepared for the recovery for this thing. So not only are you going to have to sleep sitting basically up for at least 3 or 4 days, but sorry to be gross, full medical disclaimer on this one. You also have blood dripping back that you'll end up spitting out. So they kind of give you a spittoon to put the blood in. It's rough, guys. So then the second day, you got to go back to the doctor after the surgery, and they're going to pull these, for lack of a better term, I don't know what they're really called, but they're basically like a tampon that goes way back here in your sinuses and absorbs the blood. They literally pull them out, and a whole bunch of blood and goop comes out of your nose. That's just to hold everything in place for a day after the surgery. So the second day, you're going to have to go back, and they're going to take those out. Now, I've seen some people that have them taken out themselves. My doctor took them out. Things that I wish that I had known, first of all, get a humidifier for your room that you're going to be in. Get all this stuff in advance. You're going to want a heavy kind of spittoon that if you have any blood or fluid that you can spit into, you're going to want a humidifier to keep things moist in your room so that this doesn't get dry. And my goodness gracious, get yourself both a very serious nasal rinse, whatever your doctor recommends, and get yourself a full bottle of whatever pain medication you prefer. For me, I like the Advil hard capsules, the little brown ones. That's my best pain medication, but you should get a full large bottle of whatever pain medication you're going to need. Now, they gave me codeine afterwards as a prescription. That didn't work for me. It didn't fix the pain at all. So I just used, Advil at the time to take care of the pain. But it's not an exaggeration. Now, my recovery was, of course, worse because my tongue was burned. However, like, you're not eating any solid food for at least the first 3 to 6 days. So have your significant other or yourself before the surgery fill it with popsicles, with any kind of like a real soft sorbet, any kind of like a juice or something that you like, because you're not going to be eating anything. And then get some soups that basically don't have a lot of ingredients, like Campbell's, stuff that doesn't have a lot of like big chunky stuff in there, like chicken noodle soup. That's the kind of stuff you're going to want the first few days. All I ate for the first several days was like sorbets and popsicles. That was it. And soft like popsicle. I don't mean like the hard popsicles, but like the fruit bars. Those were like game changer. So anyway, I'll tell you guys that my full recovery was about 3 weeks. Was all of this worth it? yes, it was worth it. I can breathe with my mouth closed through both nostrils right now. A lot of times when I sleep, my girlfriend says I don't snore at all. In fact, she can't even hear me breathing most of the time. So imagine that if you have to sleep with a machine, if you have to do any kind of a thing where you have a significant breathing problem that is affecting your health, is this surgery worth it for 3 weeks of recovery tops? Absolutely, it is worth it in recovery. But take this surgery seriously. Make sure you have a couple of weeks off work if you have a hard recovery. Yes, they say that you should be recovered from this surgery within a week. Was I? No, it was 3 weeks that I was down. Luckily, my work was cool about it. The first 2 weeks, they let me take off. The third week, I worked from home, and then I went back to work. But it is a major surgery, so take it seriously and prep for it. And you're also gonna have somebody drive you home after the surgery, and you should have somebody staying with you for the week after surgery to help you. Now, they don't have to be there full time. Yeah, they can go to work during the day, but before they leave for work and when you get home at night, you are gonna need some assistance. And you're just going to feel bad. Now, the rest of your body's okay. There's not anything significant going on there. You're going to lose some weight because you don't want to eat and it's gross and all this kind of stuff. But the surgery is absolutely worth it to be able to breathe for the rest of your life. I heard Joe Rogan talk about it. I heard other people talk about it, said this is like life-changing surgery for them. It is, but the recovery for it sucks, guys. It's really not a joke. It's a really serious thing. Last thing I want to say is people are going to ask about that. Yeah, I had to get a referral from my regular doctor to an ear, nose, and throat doctor. That's the doctor that you have to go through for this. And the doctor's going to write it, so that's covered through your insurance. Even though my insurance paid it, I still had to pay about $2,600 on top of that out of pocket. But the hospital was cool, just let me make payments on it until I paid it off. Absolutely worth it to get this surgery, but this is major surgery, so be prepared for it, but absolutely go ahead and have it if breathing is a problem for you. I fully recommend it. If you guys have any questions, let me down below, and I'll happy to jump in and try to get them answered for you, because I had a lot of questions myself, so I know the space that you're in when you're thinking about having this surgery.